Holly, and this is Patrick, and we're here with Randol Mill Pharmacy, and today we're going to be talking briefly about immunizations, as August is Immunization Awareness Month.
Yes, that's right. And at Randol Mill Pharmacy, we offer 5 vaccines that are pretty common and pretty well known, and we're going to spend a little time talking about what vaccines we give and also what age range those vaccines are approved for.
Yes. So first off, as we know, pharmacists, they're the most accessible healthcare provider in the community. And with that being said, our focus as pharmacists not only are in disease management, so you come see us whenever you get sick, but it's also in preventative care such as vaccines and immunizations. So starting out, who should receive immunizations?
Okay, so immunizations are for all age ranges, and specifically, let's just start right off the top with the flu vaccine. We're here in August. We actually just got our first shipment of flu vaccines last week. It usually starts in September and then gets heavier through the winter months. The flu vaccine is indicated for all age ranges. In our patient population, we mostly give adults and also for those over 65. And so there is a flu shot specifically for people 65 and over, and we do currently have that in stock. And there is a flu shot also for people younger than 65. And just to touch briefly on what Holly mentioned earlier, you know, as a pharmacist, if you want to get a vaccine, all you have to do is walk into our pharmacy. There's no wait time, there's no appointments. You just walk right up, we have some paperwork to fill out, and we can get you what you need. So ease and convenience are very important to us, and I'm sure very important to you as well.
So you mentioned the flu vaccine. Is now a good time to consider getting the flu vaccine, or should one wait until maybe later into the fall or early winter?
Sure, yeah, so I think it really kind of depends on what your plans are for the spring. I know right now with COVID, there aren't really that many plans being made, but generally what I'll tell people is just typically you have about 6 months, maybe a little bit longer of protection from the flu once you get the flu shot. So for those that are concerned about early exposure, especially a lot of our people that are 65 and over like to get theirs in August and September, and that's totally fine. If you want to get protected quick, if you want to make sure you have those antibodies and you're ready, that's fine. For some of our younger adults, maybe that say are going to go on spring break in the spring or have a vacation planned for April of next year, they may want to wait a little bit longer to make sure that that antibody exposure lasts that long. Now again, these are just general rules, just something I'll usually bring up with people. And the most important thing I can say is to get the shot, period. Getting the shot is much, much more beneficial than relying on other people for herd immunity and not getting the shot yourself.
Right. Okay. So everyone should get the flu shot, right?
Yes.
So are there any special populations or groups of people that should consider the certain timing of whenever they get their flu shot?
Sure, yeah. So I would say for sure healthcare workers like us would probably need to get their flu shots earlier because you're more likely to come in contact with people that have the flu. Probably some elderly patients that maybe live in a retirement community or in a facility where there's a lot of people all in one place. I guess really that would involve anybody. It doesn't necessarily have to be the elderly. That's just who we see more often in our pharmacy. People that fall into those categories would probably benefit more from getting the flu shot earlier.
Okay, so is there an age requirement to get a flu shot at Randol Mill Pharmacy?
Yes, so at Randol Mill Pharmacy, we give vaccines to people 18 and older. That's our kind of requirement at our pharmacy. Okay,
so I think that we've covered flu vaccines. I know you guys offer other vaccines. Can you talk about those?
Yeah, so let's move on to pneumonia vaccine. There's actually 2 different pneumonia vaccines. Currently the one that's recommended for everyone age 65 and older is Pneumovax 23. Most people remember that vaccine by the number at the end, but again, it's called Pneumovax 23. It helps cover a certain group of bacteria that can cause pneumonia. The second pneumonia vaccine is called Prevnar 13, And that used to be also widely recommended, but over the last just couple of years, actually, the scientific community has noticed that that vaccine, the bacteria that it covers, really isn't as widespread as it used to be. And so now the current recommendation for Prevnar 13 is to check with your doctor and your healthcare provider. If you have certain underlying conditions, you may still be eligible for that. But again, the only one that's currently recommended for everyone 65 and over is Pneumovax 23.
Okay. And you mentioned some underlying health conditions that go along with the pneumonia vaccine. Just to touch on some of those, anyone who is immunocompromised in any way, heart disease, diabetes, chronic kidney disease, those are all factors that someone should consider of whether or not they're a candidate for the pneumonia vaccine. Mm-hmm. I know another one that you guys offer is the shingles vaccine.
Yes, the shingles vaccine is very popular. We give that one a lot. The name for that one is Shingrix, and Shingrix is recommended for anyone age 50 and over. It's a 2-shot series, so you'll get your first shot, and then you have to wait between 2 and 6 months to come back and finish the course and get your second dose. And I get the question a lot from people that come in. They'll ask me, I got the old shingles vaccine, it's called Zostavax. I got my course completed with that. Do I need to get this new vaccine? And my answer is yes, you do. And most doctors recommend this as well, just because Shingrix is so much more effective than the old shingles vaccine, Zostavax. So yeah, Shingrix is still recommended even if you had the old shingles vaccine.
Okay, so if someone comes in and they tells you that they've had the shingles, are they a candidate for the Shingrix vaccine?
Yes, actually they are. And having shingles is physical proof that you are a candidate for this vaccine. So just a little history on shingles and where they come from. Shingles actually is the same virus that causes chickenpox. So if you had chickenpox as a child, you have the virus and it actually just lays dormant inside of you. And as you get older, maybe your immune system isn't quite as strong as it used to be, or maybe some outside forces like stress can trigger an attack of shingles. And so, yeah, anyone that's had chickenpox before, if you've had shingles, you're definitely a candidate for the vaccine, and it would definitely benefit you for sure.
Okay, great. I think the last vaccine that we have on our list to talk about is the tetanus shot.
Yes, that's right. And before we move on, I would just like to mention very briefly, some of you may have noticed that Holly has a cast on today. I just want to say thank you, Holly. Even though you may have broken your wrist, you're still here and she's still with us, fighting on through it. So thanks for still being here today.
Thank you.
Yeah.
It's a joy to be here with my fashionable cast.
Yes, that's right. So let's move on to our last vaccine that we offer at Randol Mill Pharmacy, and that's going to be Tdap, which stands for tetanus, diphtheria, and acellular pertussis. So most people would know this as tetanus, and then also pertussis is the whooping cough. So I actually see in our pharmacy about half and half. Some people may have an injury where they go to their doctor and the doctor tells them, hey, it's been 10 years since you've had your last tetanus shot, so you need to get a booster. The other half of people that come in are generally people that are either soon to be a parent or soon to be a grandparent, and they need to get the whooping cough vaccine to protect their newborn child that is about to come into the world. And so we see that most often at our pharmacy involving the Tdap vaccine.
Okay. So to wrap up this video, I don't think that we would be able to get away with not mentioning COVID. And in the media, there's lots of talk and buzz about COVID vaccines in the pipeline. Do you have anything to say about that?
Well, I think we're all waiting and anticipating and watching very closely. I haven't honestly heard many facts. I know a lot of trials are in phase 3, which is kind of the very end, but it's also the most complicated and the most involved phase of a clinical trial, usually involving thousands of people. So it takes time to collect that data. We definitely want to make sure it works, but you also want to make sure that it's safe. We don't want to rush anything out there and start giving vaccines and we find out 6 months down the road that there's an issue. So I guess, even though no one wants to be patient right now, everybody wants us to be over with and done and move on. Patience is kind of what we have to rely on. Hopefully, you know, I keep hearing the beginning of next year, but again, that's just speculation. I can tell you though, as soon as the vaccine is ready, Randol Mill Pharmacy will have some and we'll be able to give them.
Okay, great. Well, if you have any questions regarding any vaccines that we've talked about today, you can feel free to call Patrick at Randol Mill, or you can also find all of this information that we talked about today on the CDC website. They have a good breakdown that's easy to read and talks about who should get which vaccine and when they should get it, side effects, and the diseases that the vaccines are preventing.
Yeah, and just one more thing, I can't let this video end without letting you know that Holly just graduated from pharmacy school back in May and passed all of her exams and just received her license. So Holly is now an official pharmacist, so congratulations, Holly, on that.
Thank
That's
you.
Awesome. Yes,
Thank
very
you so
good.
much. I appreciate it.
Yeah, so yeah, Holly wrapped it up nice. You can check out the CDC for any additional information, but yeah, that's it for vaccines.
Yeah, well, thanks for watching our video. See you next month.